Good morning, everyone. My name is Keith Ciccone, nurse specialist at St. Elizabeth's Medical Center in Brighton, Massachusetts, in the Department of Neurology. We would like to welcome you to our third annual Parkinson's Disease Symposium for Veterans and First Responders, presented by St. Elizabeth's Medical Center, Department of Neurology, in collaboration with 110 Fitness in Rockland. Today, we welcome you to a morning program to help optimize life with Parkinson's disease. This program geared towards our veterans and first responders, patients, and caregivers. We hope you enjoy our program this morning. Sit back and have a great day. Thank you.
Thank you, Keith, and welcome everyone to the third annual Parkinson's Symposium for Veterans and First Responders. As Keith said, on behalf of him, myself, St. Elizabeth's Medical Center, and 110 Fitness, we're so excited to be here with you virtually. I want to thank our sponsors who made this event possible, and we so appreciate all their support. Our general sponsor, Synovian, kernel sponsor, Amneal, major sponsors, Encompass Health and MERS Pharmaceuticals, and our lieutenant sponsors, Supernus Pharmaceuticals and Boston Scientific. You will be hearing from our sponsors throughout the symposium, and you will also be hearing from our community partners, the Parkinson's Foundation, the Phinney Foundation, Team Fox, and the Jewish Family and Children's Services. Together, we are all working towards helping individuals with Parkinson's disease live their best lives at 110%.
We are honored today to have Daniel M. Clark, known as the Singing Trooper, sing the national anthem as he kicks off our third annual Parkinson's Symposium. While serving as a Massachusetts State Trooper for 20 years, he performed more than 2,500 events for federal, state, local, and military functions. After 4 years of distinguished service in the United States Marine Corps, he received an honorable discharge as a sergeant in 1984. We thank him for his service to our country in Massachusetts. It is my pleasure to introduce the singing State Trooper, Dan Clark.
See by the dawn's revealed light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched, so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave.
It is an honor for me to introduce Dr. Anna Hohler, Chair of Neurology at St. Elizabeth's Medical Center in Brighton, Massachusetts. She is the Director of Medical Student Education for Stewart Healthcare and is the Assistant Dean of the St. Elizabeth's Medical Center affiliate site for Boston University School of Medicine. She is also a Professor of Neurology at Tufts University School of Medicine and Boston University School of Medicine. Dr. Hohler completed her undergraduate and her medical degree at Boston University in the 7-year accelerated medical program. Then she completed her internship and residency in neurology at Madigan Army Medical Center in Tacoma, Washington. After 8 years of distinguished military service in the United States Army, she was honorably discharged, having achieved the rank of major. Then she completed a fellowship in movement disorders at Boston Medical Center and served there for 11 years. Dr. Hohler has been on the international front lines in the field of neurology for 20 years and is the former president of the Massachusetts Neurological Association. She lectures nationally and internationally on neurological, movement, and autonomic disorders. Dr. Hohler has authorized over 70 manuscripts, reviews, chapters, and quality improvement measurement sets. We are excited to hear her presentation on reintegration after COVID-19 vaccination for patients with Parkinson's disease. Dr. Hohler.
Okay, good morning everyone. Today I'll be talking to you about reintegration after COVID-19 vaccination for Parkinson's disease patients. The steps for reintegration that we'll be discussing today include vaccination, rational mask utilization, reintegration with family and friends, crowd management in stores and restaurants, travel strategies, and the future of vaccination. Coronavirus 2019 is a respiratory disease, and it can cause a spectrum of illness from mild to severe. Older adults and people with underlying medical conditions are at higher risk for complications from COVID-19 illness. These viruses are similar to some of the viruses seen in history, such as SARS, severe acute respiratory syndrome, MERS, Middle East respiratory syndrome, and this new disorder emerged in 2019 from China to other countries, including the US, now called COVID-19. Signs and symptoms include things like fever, shortness of breath, malaise, difficulty breathing. People can also experience confusion, muscle aches, headaches, and specific to this, loss of sense of taste and smell. Some of the most common COVID-19 symptoms for people with Parkinson's include a worsening of their underlying Parkinson's symptoms. So people may have more stiffness, slowness, difficulty with their walking, and an increase in their tremor. Some people who have COVID-19 infection with Parkinson's disease require an increase of their medication during the illness and potentially for some period of time afterwards. In addition, there are some patients who suffer from COVID-19 who have problems with their autonomic symptom, resulting in difficulties with blood pressure or heart rate dysregulation. This can cause lightheadedness, near fainting, or even fainting. Movement disorder specialists recommend the COVID-19 vaccination for all patients who are eligible with Parkinson's disease. 2 COVID vaccines are now available in the United States. Both vaccines provide protection in the event of COVID-19 exposure and help the body more rapidly clear the infection. If you have Parkinson's disease, you should get the COVID-19 vaccine unless there is a contraindication. Please discuss with your primary care physician and sign up for the vaccine as soon as possible. The vaccines both require 2 injections, several weeks apart. The injections should both happen at the same center. So plan accordingly when you're scheduling your appointments. There are different components in each of the vaccines as you see displayed. And if you have an allergy to one component in one vaccine, you will likely still be eligible to receive the other vaccine. In addition, there is another vaccine that is pending FDA approval from Johnson & Johnson. This is a 1-injection vaccine. This vaccine was 85% effective in preventing severe disease across all regions studied 28 days after vaccination in all adults 18 years or older. This vaccine from Johnson & Johnson may be available in the next month or 2. What are the contraindications to receiving the COVID vaccine? They include a history of severe allergy to a vaccine or injectable medication, pregnancy or planning to be pregnant in the next 2 months, breastfeeding, presently taking blood thinners or have a clotting or platelet disorder, immune system disorder or actively taking immune suppressive medications, presently enrolled in a COVID treatment or prevention study, or if you had a COVID infection and have been treated with monoclonal antibodies within the last 90 days. If any of these apply to you, please discuss your case with your primary care provider. Access to the vaccine is available through most states through their Department of Health And many healthcare centers, particularly within the state of Massachusetts, also are administering vaccines. Typically, this is coordinated through your primary care center. The VA, which is near and dear to all of our hearts, does have vaccine for the VA patients, and they're using the Moderna vaccine at this time. Currently, VA healthcare personnel, veterans living in long-term care facilities, and individuals who are 75 years or older may be eligible for the vaccine. Over the ensuing weeks, the age restrictions will be decreasing periodically, so the next available option will be for 65 and over patients. Each facility through the VA determines how the patients will be administered the vaccine, so please check out www.va.gov/healthcare/COVID-19 vaccine for more information. Or you can just Google the VA COVID-19 vaccine. For steward patients who have a primary care provider in our system, there is a vaccination program that has been rolled out for patients currently 75 years or older, and you need just some verification to confirm your eligibility with identification at the time of the vaccine. Please contact your primary care provider for further information. What to bring to the vaccination? You want to bring your personal information and medication list. If you're prone to fainting, let the nurse know and they can administer the vaccine in a lounger chair. You should also bring extra water to take before and after the vaccine. If you have any allergies, please feel free to bring your EpiPen, although there is no clear associated risk with injection site reaction if you have allergies that are not related to vaccines. For the second shot, you're going to be given a card, and you bring that back for the second shot where your name, the type of vaccine you were administered, and the date you were administered the vaccine will be documented. You want to take a picture of that card to make sure that you have it in the future, should it be needed for travel, for example. At the vaccine center, you're going to enter and fill out paperwork consenting to be administered the vaccine. You're going to receive the card with the information I discussed. When you receive the vaccine, it's going to be just like how you get the flu shot. You want to wear short sleeves and maybe a zip-up sweatshirt or sweater to have easy access to your arm. After the vaccine, you'll sit for 15 minutes while you're monitored for any type of side effects. And then you'll proceed through the checkout to confirm that you don't have side effects, and then also to remind you of your follow-up date. Some side effects from the COVID-19 vaccine include pain at the injection site, fatigue, headache, muscle pain, nausea, chills, joint pain, fever, and injection site swelling or redness. Some people complain of a little bit of an increased reaction after the second injection. If you're able to take an NSAID or over-the-counter Tylenol, ibuprofen, you can feel free to take that in association to reduce these symptoms or should those symptoms develop. If you are allergic to an over-the-counter anti-inflammatory, please consult your primary care doctor to discuss options. Now, after you have the vaccine, you can still get COVID. Your chances are lower and your immune response should be better with less chance of adverse outcome. You still need to wear a mask and distance 6 to 12 feet after receiving the vaccine. You want to continue to avoid crowds and wash your hands with soap and water for 20 seconds or use a hand sanitizer with at least 60% alcohol. You're going to follow the CDC travel guidelines and you're following the quarantine guidance if you've been exposed to COVID-19. You also want to follow any applicable workplace guidance. How to reintegrate with family and friends. First of all, you want to avoid interactions with known COVID-positive individuals or those who have been exposed to COVID-positive persons. When transitioning to in-person visits, if possible, have COVID testing prior to the interaction. Outside visits with masks are best if feasible from a weather standpoint. Once individuals are vaccinated, COVID rates are decreasing and herd immunity is developing. Reintegrate with liberal hand washing and use of sanitizer. The CDC will provide additional guidance as to how to do this best. You also want to use hand washing and sanitizer prior to visits and after to reduce your infection. You could start with small gatherings of less than 6 people who bubble together. Over time, you can increase the people in your bubble as COVID rates decrease. You want to definitely wear masks in crowds and avoid large events and maintain social distancing as much as possible. Crowd management in stores and restaurants. Continue to use age-specific store access while it is available. Oftentimes, stores provide the first hour of the day for individuals either 65 or 75 years or older. This will reduce your risk for exposure. Once stores open up completely in all time slots, choose time slots that are less busy, like early morning on a weekday, Tuesday through Thursday. Restaurants will have more availability and will increase the number of patrons. Choose times that are less crowded, such as 4 to 6 p.m. for dinner, if feasible. At the restaurant, use hand sanitizer provided before your meal and bring your own hand sanitizer to use after utilizing the bathroom. For travel, do not travel if you've been exposed to COVID-19, if you're sick or you test positive for COVID-19. Learn when it is safe to travel and don't travel with someone who is sick. You want to check travel restrictions before you go. Various states in the United States have different travel requirements, and international travel is still significantly restricted. You want to wait 2 weeks after getting your second vaccine dose to travel, because it takes time for your body to build protection after a vaccination. And depending on when you travel, get tested with a viral test 1 to 3 days before you travel, if that's a requirement for the state that you're traveling to. You want to keep a copy of your test and preferably a printout if needed to demonstrate that you've either had a COVID test and or been vaccinated, depending on the requirement. Do not travel if you test positive. You want to wear a mask over your nose and mouth when in public settings. Avoid crowds, as mentioned before. Wash your hands often and use hand sanitizer. Bring extra supplies. Avoid contact with those who are sick, and avoid touching your nose, eyes, and mouth. When traveling on a plane, train, or in a rental car, consider bringing antiseptic wipes such as Clorox wipes to clean down the tray table in front of you, the armrests, the steering wheel, and the center console, depending on what type of travel you're doing. Try and eat or drink prior to getting on the plane if possible, and try and avoid using the bathroom on the plane if possible. If you do need to use those things, bring your antiseptic wipes, make sure you wash your hands thoroughly, and use hand sanitizer. What's the future of COVID and vaccination? Vaccines are currently being evaluated for their effectiveness versus mutant variants, and in the fall/winter of 2021 or early 2022, there could be increases in the changes in our current vaccinations to adapt to these mutant variants if needed. We suspect that vaccinations will likely occur yearly based on the virus variant found during each year, much like we have with the flu vaccine. More is to come on all of that. So with COVID-19 and Parkinson's disease, as a patient with Parkinson's, you should get the vaccine as soon as you are eligible. You want to continue to practice safe reintegration practices with social environments, family, and friends. You want to take precautions when traveling to lower your COVID risk. You want to consult your primary care physician or neurologist about specific concerns related to your health. There is light at the end of the tunnel. Thank you. And now some questions that were submitted by the audience. First of all, for new or follow-up appointments, please call our clinic at 617-789-2375. We're available to do visits either via telehealth or in person. One question from the audience: if I had COVID-19, should I still get the vaccine? And you should. The CDC recommends waiting a few weeks after you recover from COVID-19 to start the vaccination process. Can you still get the COVID-19 infection after you get the vaccine? As we mentioned before, yes. Much like the flu vaccination, once vaccinated, you can still get the infection. In most cases, the symptoms would be less severe. Will the Pfizer and Moderna vaccines be effective against new strains being encountered in the United Kingdom and Europe? And the answer is yes. Both the CDC and Pfizer indicate that the vaccine will be effective against new strains of COVID-19. Another question from the audience. Does all of this information apply to those with Parkinson plus syndrome, such as progressive supranuclear palsy, PSP, multiple system atrophy, MSA, or Lewy body dementia or disease, LBD? So these recommendations apply to all Parkinsonian syndromes. However, if you are prone to blood pressure fluctuations, as I mentioned before, you can request to lay down for the vaccination process. You should also bring water to take before and after the vaccine if you are prone to fainting, and let the healthcare provider at the site know that that could be a possibility. If you get the COVID vaccine, how soon after can you get other shots, such as the shingles shot? You want to wait 2 to 3 weeks after your second COVID vaccine before scheduling any other vaccines. One question was, will the vaccine alter my DNA? These vaccines will not alter your DNA. These mRNA vaccines do not change or interact with the DNA in your cells in any way. What they do is trigger your body's immune response for if it sees the COVID-19 vaccine, so that it's prepared and is able to identify and take care of the take care of the COVID-19 as quickly as possible, the virus. So after you have the vaccine, at the end of the process, our bodies have learned how to protect against future infection, and the immune response and making antibodies is what protects us from getting infected if the real virus enters our body. If you're allergic to other vaccines, should I get the COVID-19 vaccine? Please don't assume that you cannot get this vaccine. You should talk to your primary care doctor if you have any concerns against this vaccine or any of the additives in the vaccine. In many cases, people with other allergies to vaccines have received the vaccine and have done well.
Hi, my name is Donna, and welcome to our home. I have blepharospasm, which means I can't control the muscles around my eyes and sometimes around my nose. And I've had blepharospasm for probably about 20 years. But about 10 years ago, my doctor recommended that I try a new product, and that product was Xeomin. Xeomin and I had an instant connection, an instant match. I just love it. It has changed the countenance around my face, and I believe that it has made my life so much better. I appreciate Xeomin so much, and I can't believe it's been 10 years that I've actually been on Xeomin, and I can't believe that it's the 10-year anniversary. Thank you so much, Xeomin, for changing my life and for changing the lives of others. Thank you, Xeomin, and happy anniversary.
Next up, we have Brett Miller. Brett is the founder and owner of 110 Fitness, the largest wellness center in the world for individuals with Parkinson's disease. Brett is a licensed physical therapist with 26 years of experience in all settings, including sports therapy, acute and intensive care, long-term care, and wound care. He has worked in the fitness industry for over 25 years with extensive experience in kickboxing, spinning, rowing, and strength and conditioning. He has worked as a strength and conditioning coach for world-class boxers and Olympic athletes, focusing on injury prevention and rehabilitation. Brett was also an adaptive sports coach at New England Disabled Sports at Loon Mountain in Lincoln, New Hampshire for 18 years. Brett is a U.S. Army veteran and is proud to have served as a combat medic trainer for special operations and oversaw the construction and development of the DEP-MED system for the United States Army. Brett is a Power Moves certified therapist. He is also certified in Concept 2 rowing, pedaling for Parkinson's, SCW boxing fitness, SCW aquatics exercise, Tai Chi Chuan, moving for better balance, CPR and AED, and he is a licensed boxing second in the state of Massachusetts. Brett also serves as an ambassador for the Michael J. Fox Foundation for Parkinson's Research, as well as the Phinney Foundation. He is also a research consultant for innovative United States research companies, as well as prominent hospitals and for the Cleveland Clinic. Welcome, Brett.
Thank you, Anna, for the warm introduction. And on behalf of the 110 Fitness family and myself, we want to welcome all the veterans and thank you for your service. Today, what I'd like to speak about is something that we think is obviously very timely and appropriate. and that is staying physically and mentally fit in a pandemic. It's been about a year for all of us, and these are the things that we need to consider, because we used to have places to go, and we used to be able to socialize a lot more, and we used to be able to go to the gym and stay fit, and a lot of that has been taken away from us due to the COVID-19 pandemic. So I'd like to talk today a little bit about that and how I think you can maximize your performance and best manage your symptoms with Parkinson's disease. One of the things that I like to do every year when we have this symposium is just give everybody an update demographically and also a research update. And so today what I just wanted to talk about is the VA, the Veterans Administration, estimates that about 110,000 veterans are afflicted with Parkinson's disease, which is a lot of people considering. And if we look at the economic burden, and I've talked about this before, we're looking at $51+ billion a year that is being spent on Parkinson's disease and the care of for people who have the disease. But what I wanted to really point out here is that the veterans are responsible for only 3% of that number, but that number is $1.6 billion that it's costing for healthcare purposes, caregiver purposes. So it's a very significant amount. Just to point out the demographics and the amount of financial burden that is associated with Parkinson's disease and veterans. I also wanted to give you a really nice update. One of the things, being an ambassador for the Michael J. Fox Foundation, has allowed me to be very involved with the Research Roundtable and all the people that are, in the trenches doing the research and finding out really what's going on with this disease. And so I like to kind of recap the year and give everybody just an idea of sort of what's going on, what's happening in the future, and some things to look forward to. So this year in 2020, we had some new therapies come out, the Kinmobi and Ongentys, which are some of your rescue medicines for off times. Those were both FDA approved in 2020. And then we were also very lucky with Medtronic's new DBS program called the Percept. And what this does is it actually individually records the brain signals of the individual, and that gives us a lot of hope for the future and what we might be able to do with those tools. And I also want to show you that 17 new therapies have been approved by the FDA from 2014 until 2020. And we only have 39 therapies that are approved. And so almost half of the therapies that have been approved have happened just in the last 6 years. So you can see here that the focus is very much on Parkinson's research. And so that makes us very hopeful for the upcoming years. Some of the new research that the folks out there are doing for us moving into the calendar year 2021 is we're looking at some new expanded indications for some of the medicines out there. Some of you may be familiar with Gocovri or Nuplazid for hallucinations. And some of the other new medication developments is we never really had a lot of medications that would be dedicated towards some of the other things that go on with Parkinson's disease most of you are familiar with. So there is a drive to come up with some new medication prescriptions for dyskinesia, sleep issues, and constipation. Some of the technology developments that are occurring, Ohio State and believe it or not, Honda Motors are working on some new solutions to improve walking and balance. They have some neat things. I've actually seen some prototypes, very exciting, coming down the pike for us this year. And also there's some new scans. A lot of the research consultants are looking at a protein that activates inflammation in the brain. It's called the NLRP3 protein. And they're looking at designing a scan that actually follows this protein and gives us an idea of what it's actually doing in the brain. So that's some really great technology development that's coming to us through the research world. And then from a community development side of the fence, I did talk a little bit last year about the Edmund J. Safra Fellowship, which is developed by the Michael J. Fox Foundation. And it's a fellowship that pays for people who would like to become movement disorder specialists in the nooks and crannies of the country that it's very difficult to find these professionals in that discipline. And so they actually pay for their education. And this year, they actually graduated, I believe it was 6 new graduates. And they are hoping by the year 2025 that there'll be up to about 48 specialists that will be sort of embedded in these areas so that people can have access to such great movement disorder specialists. And then something else, that we've been working on here at 110 Fitness, and we've been very heavily involved working not only with the Michael J. Fox Foundation, but also with some other people across the country who are some key players that can sort of help us from an advocacy point of view. And we're working on a national plan on Parkinson's. And what that means for you out there is really finding a way through Health and Human Services and the federal government to explain to them that there needs to be some reimbursement from insurances and insurance companies to pay for wellness centers that are carrying out ethical programs for Parkinson's disease. So a lot of great research updates here. I always like to present this. And again, being involved with the Fox Foundation and the Phinney Foundation really allows me to stay up to speed with all this. And I love to share all this for you because it really gives us a lot of hope for the future. So let's talk about exercise, all right? What is a well-rounded exercise program for the general person, right? Obviously we talk about strength and aerobic capacity, balance, how quick can we move, agility, and flexibility, right? Those are all sort of the key 5 components for what we would call a well-rounded exercise program. But let's talk about something that's more PD specific, What are the effects of exercise specific to Parkinson's disease, right? And how that makes you better manage your symptoms and how that makes you better function throughout your day. Neuroplasticity, right? It's the word that we all talk about, right? So, neurogenesis is that sort of procedure that creates neuroplasticity. Stronger synapse connections, well, what are those, right? That's when those motor neurons in your brain are firing and they're sending signals and everything's working quick and efficient. And exercise does that, and it helps us make those stronger and real quick. Growth factor level increases. The big thing that I talk about, as a physical therapist and looking at effective exercise for Parkinson's is talking about BDNF, right? That protein that's made in the spinal column. It's called brain-derived growth factor. And we know with high-intensity interval training that is released in a very, very large amount, and it is responsible for great things that occur in your body: memory, executive functioning, cognitive functioning. And then, of course, also the GDNF2, which is the glial cell neurotropic factor. So both of those increase with effective exercise programs and make you better, right? Decreased neurotoxicity, so MPTP and 6-oxydopamine, those are some of the chemicals in your brain that break down dopamine structures, right? So we can eliminate that process of neurotoxicity, or not necessarily eliminate, but decrease that with exercise, and we've seen that in the research. Neuroprotective effects specific to the dopamine cell structure. So again, with high intensity exercise on imaging, we are seeing that the cell structure of the dopamine cell itself is lessened through high intensity interval training. And then all the great things that we talk about. So motor functions, that typically don't respond to medicines. And then, memory, cognitive functioning, like how fast your brain works, neuroagility, or what we call neurofitness. So those are sort of all the effects of exercise. So just looking at this slide, everybody out there, you should be involved in a really great exercise program to manage your Parkinson's disease. But the caveat there is it needs to be carried out by somebody who really is a professional, has their certifications in these things, and knows how to carry out standards of care that are perfect and specific to that. So this is one of my favorite quotes by Michael J. Fox. I'm always trying to find the perfect cocktail of meditation, and now I think I've found it. And when I think about that, I think of, what is a well-rounded program for you with your Parkinson's disease that best manages your symptoms and manages the function of your life. And so when we look at multimodal exercise, we talk about several different things. Resistant training, right? So we're trying to increase our muscle strength, which therefore increases our functional mobility and also increases our balance. Aerobic endurance, right? We have to take care of our hearts anyways, right? So cardiorespiratory fitness and exercise tolerance. Balance training, right? If we're doing these things, right, our timed up and go tests, which you all have done in your doctor's offices, are better. We look at reductions in fall rates, and we look at reduction in healthcare costs with fall rates. We look at, safe velocity when you're walking and balance confidence. And then not to forget, right, all of the other complementary things. You know, at 110 Fitness, you know, we do Tai Chi, yoga, dancing, drumming, boxing, pedaling for Parkinson's, cycling programs, right? All of those things, you know, make that beautiful recipe and that beautiful picture and complement all the different things that you're trying to access for your body to make you live your best life with Parkinson's disease. And one thing that I just want to point out is that we do know that, you know, the UPDRS, some of you have taken that test before, the Unified Parkinson's Disease Rating Schedule. All those scores are so much better when you have that recipe of multimodal exercise. Mental benefits of exercise. A lot of people never talked about this, but we're finding, especially now in the pandemic, that we need to be proactive mentally in taking care of our brains in order to tolerate and be resilient to all the things that are going on in this world. And so, you know, personally, I think that the mental piece of fitness is equally important to the physical piece of fitness. And so one of our friends here, her name is Jackie Bonwell. She's a yoga trainer. And one of her quotes, which I think is so poignant here, is it says, your biography becomes your biology, right? So all the things that you do and all the things that you carry out physically, spiritually, mentally, that's what becomes you physiologically, right? So, you know, if you're under a lot of stress, you may physiologically represent that as someone who doesn't feel well all the time, or maybe gets colds all the time, or is immunosuppressed, right? So all those things occur. So what you do is inside here, right? And all of that stuff manifests itself. So what are the true mental benefits of exercise? Well, obviously we all know stress reduction, right? And all of you out there know that when you are stressed, your Parkinson's symptoms right through the roof, right? So that's something that's key, right? Is staying mentally fit to keep your stress reduction at its lowest. Clear thoughts and memories, improve sleep. Who wants better sleep out there, right? There's so many people with Parkinson's disease who have horrible nights where they're either getting up multiple times or they can't stay asleep for long periods of times. And, you know, being mentally fit will help your sleep. It will make you mentally fatigued, which will allow your brain to rest when you go to bed. Better social skills, decreased isolation. We've all been in this forced isolation, right? And so, you know, once you start to get mentally connected and positive connections with other people through interaction, right? Better social skills. A lot of you may have, you know, when you first started having Parkinson's disease, maybe didn't engage people because you were afraid that your social skills were off, or you were afraid to talk because you might stutter or have a speech issue. So being mentally fit, you know, gives you that, you know, that optimization of having all of those things. Stronger self-awareness, right? Being aware like what you need, right? Mentally, like not like, oh, I'm aware of I'm, you know, curling 10 pounds and I'm getting stronger. More about like, you know what? I am having issues with X and I am aware that I need to maybe do Y in order to make that better. So being self-aware of, you know, what's really going on with you and how you can best manage that. Here's the most important part, right? If we have decreased mental health, our physical health is going to decrease, right? Which is going to decrease our function, which is therefore going to decrease our independence, which is therefore going to increase, obviously, our caregiver load or whoever is, you know, living with us, maybe our family. And then all that does is just elevate your anxiety and can obviously cause a lot of depression. So that's the real take home here. And you'll see in the bottom here, you know, I've got my boxing glove and my brain. You know, the best recipe here is, and you can see that flow, right? Being physically fit helps mental fitness, and being mentally fit helps your physical fitness and overall your physiology. And some of the things that you have to remember is when you are physically fit and you're doing the work and you're mentally engaging people and you're doing the mental fitness piece of it, it reminds you that you're not alone, right? This pandemic has caused all this isolation and sort of kept us in our homes, but we have an opportunity to engage people through Zoom and through all these different platforms to have our social skills and positive comebacks with, you know, relationships with people. And so, you know, you're not alone. There's a whole bunch of other people here today watching this program who are with you and part of your team and who are experiencing the same things that you are. There is light at the end of the tunnel, and we reaffirm everybody that at 110 Fitness. This will start to settle down. The dust will settle, and you will start to be able to get back to your wellness centers and engage people, you know. And then the other thing is it just offers such a great, better quality of life. When you feel mentally fit and you feel physically fit, you know, you're there, right? And you know that you're in that sweet spot of feeling really well. And one of the other things that I like to point out is through this process is knowing, you know, when to ask for help. And sometimes talking to somebody about your experiences makes you recognize that self-awareness of like, you know what, maybe I should reach out to a professional. Maybe I need to talk to that neuropsychologist. Maybe I need to call my movement disorder specialist. Something's just not right. But knowing when to ask for help is so important, not only in life, but clearly, you know, with Parkinson's disease. So, what did we do at 110 Fitness? The pandemic happened. Mental warfare for everybody, correct? Especially for people with Parkinson's disease. I can't see my friends anymore. I can't go out. What if I get COVID, right? So all these things occurred. So we said the same thing. What are we going to do? How are we going to help our community? And so our response was the 110 Fitness app, the first ever wellness app designed for people with Parkinson's disease. Okay, 18 categories so far. And the ability to live stream. It's everything I talked about, being able to see an instructor and a coach who motivates you and who is positive and who can help you live, right? There's that interaction, that mental fitness piece. And at this point right now, almost over 200 pre-recorded videos, okay? So here's just an example of some of the things that we put in the 110 Fitness app. Tai Chi. Education, right? This is knowledge and it is power, right? If you are educated and you know what's going on and you are doing the work and learning all about what goes on, what's coming up in research, how you can get involved, right? It's such a wonderful thing. Mindful meditation. Everybody says, I can't do it. Well, get on this app. You can do this. It only takes a minute, 2 minutes. You've got to start somewhere to kind of get that flow, right? And start, you know, really enhancing the chemicals in your brain. Vocal work. Everybody talks about speech issues or swallowing issues or my vocal cords, you know, are not working. Some of you out there may have experienced injections in your vocal cords for other issues. We have a category that involves you using your voice, right? Which therefore helps your forced expiration, your diaphragm, your lungs, your pulmonary system, right? That ability to cough when you're not feeling well, that ability to shout if you need help, right? Those are the things that you need to do. And then, of course, here's just a picture of our yoga category as well and our ability to live stream. One of the things that we added because we knew we had to, we wanted to make an app that was so well-rounded that it had every single category that someone with Parkinson's disease could relate to. And therefore, again, it's that multimodal recipe that Michael J. Fox talks about, right? The Parte, right? Parkinson's Art of Expression classes. So this is a way of using theater to express yourself. We all know that with Parkinson's, a lot of times there's that flat affect of the face. We become a little bit more, less, able to express our emotions. And so this is such a neat thing. It rewires your pathways. There's research going on right now. All it does is encourage socialization with other people. And the nicest thing is it increases your mood, your self-confidence. And then, of course, because you're actually acting out scenes, you're moving your body and you're not even aware that you're doing all this movement. So Parte is something on there that we recommend for everybody. And to get involved with that, it's just a really neat category. Spin Poi, right? Our friend Dr. Regal out here in Australia. She is amazing and has helped us make some videos and really helped Poi come alive all the way over to America. We're helping her with some research that's going on currently with Spin Poi. And, you know, really Poi is just the name of the article that you see there. It's a ball attached to a rope. But the wonderful things, if you come to 110 Fitness, we use them a lot to engage range of motion, to break up rigidity and some bradykinetic movements. So Spin Poi is actually on our app as well. Power moves. Everybody knows the power moves out there, and if you don't, you are missing out, all right? Parkinson's Wellness Recovery, right? Our friend Dr. Becky Farley, also a physical therapist like myself, who is also the creator of LSVT Big and Loud, designed this beautiful program. It is neurofunctional, amplitude-focused, And it is intentional activity that if you have Parkinson's disease, can work in any progression wherever you are with your Parkinson's disease. I would do this. Okay, we do it all the time here at 110 Fitness, and it's amazing. One of the things that we're just bringing to you today, so you're probably the first people to hear this, is we're adding a category called the Brain Gym. One of the things when we looked at sort of an after-action review of our app and sort of, what are we missing here? We thought we had everything, and I recognized the fact that we're missing that piece, okay? Cognitive ability, executive functioning, working memories, neuroplasticity, neurofitness, exclusively for the brain, right? So these are things that you can do, games that you can do, different things that you can do to really, really charge your brain to be sharp and effective. And so that's coming down very soon as we put that together with some filters that we're working with and other different things that really will be neat. And we'll be pulling in some of the professionals all over the country who are really the gurus of what we call brain fitness, and we'll be using their techniques as well. So what are the benefits of the app, right? Well, why would I get the app, right? I have 110 Fitness to go to. Well, not everybody has a 110 Fitness to go to, and not everybody wants to come to 110 Fitness because of the pandemic. And so this is again, a way of, rescuing people, giving them the freedom of movement that they've always had by going to their wellness centers, but being able to do it in the comfort of your own home safely. So obviously, this is a COVID-safe thing to do, right? It's also available to anybody in the world. So you could be in the middle of East Oshkosh, Texas, and not have a movement disorder specialist 5 hours away from your house. But if you have a tablet, you have a cell phone, which most people at this point have, we've done our research and we know that to be true, you can access our app, right? The variety is there. No one can argue that. It's got everything, right? It's competitive, okay? If you're on there and you are working with your fellow Parkies out there, we have a leaderboard where you can get to be on the, king of the hill or king of the mountain or queen of the mountain if you want. And those of you that do the most exercise, you win. And it's monthly, it's weekly, and it's yearly, right? Tracking your symptom management. Last year I talked all about this, was documenting and journaling your symptoms based on what you're doing and what works best for you. We talked about the OODA loop. All you flight pilots out there, you know about the OODA loop, right? So using the app to track your symptom management, right? Saying I did boxing, I did drumming, and I did a yoga class, and I've never felt better. Write that down, right? And figure out that recipe. It's affordable. We did our research. We tried to make this the most affordable thing in the world for everybody out there. And all the, there is no other app out there. We're the only one, and we're the first ever. But the online programming that we're seeing, $150 to $300 a month. And you have to buy all this equipment on top of that. The 110 Fitness app is $50 a month. Unlimited. And again, all those subscriptions that are on the app, if you do decide to upload the app, have a free 1-week trial. So incredible resources. Once you're looped into the 110 Fitness app, you're looped into 110 Fitness. You become part of our family, and we support you with our advisory board that we have here, all of our wonderful movement disorder specialists who we can ask questions to in the case that you don't have one, or maybe you're looking for one in your area. All the research updates. We're constantly giving research updates here and pumping those out. And so you become part of our distribution list, and you'll get an email. Typically on a daily basis, we have something called the Daily Grind, which has every resource you could imagine. So then you're already tied into this big family of people who are living the same lives as you are and dealing with the same things you are. And so we all make each other better. The other thing I just wanted to talk about too is we're also looking at doing a bunch of scholarships through some grants that we've written, and we're hoping to be able to offer that sort of in the middle of 2021, where there'll be an application process and you can actually receive the 110 Fitness app for free, especially for people who are having financial hardship and having trouble, finding these resources in their sort of demographics. One of the things also that we thought would be really important is some people like to have the stuff, right? You like to have the swag, or you want maybe a couple dumbbells, or maybe you want an agility ladder to lay out when we do our foot drills. So we have a store, right? An online shop. You can get swag, accessories, gift certificates. You can buy books, things to educate yourself. All those things are on the app. Now, I'm just going to reflect back a couple slides. I talked about knowing when to ask for help. And that is something that we wanted to include in our 110 Fitness app. And so what we did is on the online shop is you can go in there and you can actually purchase a virtual evaluation and treatment design. So if you're somebody who doesn't have resources and you need some help and you know it's time to ask for help, this is one way of doing it. You can purchase this on our app, or maybe ask somebody to buy it for you if you want a gift certificate or something like that, or what a wonderful Christmas present, right? To sit down with a professional and from soup to nuts go over everything that's going on in your world, Parkinson's wise, and getting the design treatment to best serve your symptom management, and also maybe tie you into some resources that you may not have known that were available for you. And so it's a 2-hour intensive assessment. There is a packet that is emailed out to you to fill out prior to the evaluation. If you have difficulty writing or some micrographic issues, that can be done as well over the Zoom. And it's with a credentialed professional. It's done with myself. And so what I do is I create the perfect personalized recipe for your symptom management, optimizing your performance, and again, trying to find that recipe for mental and physical balance, right? If you're reaching out for a friend, or maybe you're a family member watching for your family member, this might be something. If you don't have the resources to reach out to us, give me a phone call. Go ahead and email me. I'm happy to help. Even if you don't want to take advantage of this, maybe just to find some resources that may be not available in your space. And then last, I always like to leave my information up here. You can see when I designed 110 Fitness, it was what we are talking about today. It was be fit, be mindful, be well, be 110. It's that spiritual, physical, emotional, mental balance that we're looking for here to find how you can live your best life with Parkinson's disease. So this is my email address, our website address, all of our social media information, Facebook and Instagram. And I always like to remember to let everyone know to search the 110 Fitness when you go into the App Store or your Google Play. And again, this is for Apple or Android devices. And you'll see our lovely slogan and our brand pop up here. And that's the one to choose. And you can just scroll through and see if that's something that might work for you. Again, if you are isolated or stuck in your home. But again, just to recap, physical and mental, they work off of each other, and it's so important that you find that balance. Thank you so much.
If someone you love has lost independence due to a major injury or illness, help them find it again here at Encompass Health Rehabilitation Hospital. With custom advanced therapy that includes extra levels of safety during the current health situation, when a loved one's return to independence depends on you. Depend on us.
It is my pleasure to welcome Secretary Poppe, who is the Secretary of the Department of Veterans Services. Secretary Poppe holds a Bachelor's of Arts in Elementary Education from the University of Rhode Island, a Master's in Business Administration from Salem State University, and completed Commander in General Staff College. Secretary Poppe served 30 years in the Massachusetts National Guard. During her time in the National Guard, she oversaw personnel preparedness for one of the largest deployments of soldiers and was involved in the National Yellow Ribbon Working Group to develop a template for state programs based on collaborations with federal and state agencies. It is our pleasure to have her speak today about veteran services related to Parkinson's disease in this state. Secretary Poppe.
Thank you, everyone, for hosting the symposium today. I'd like to thank you from the Department of Veterans Services for taking the time to give out all this information to veterans, caregivers, and first responders dealing with Parkinson's disease. And really thank you for taking the time to make coverage on this and have a discussion. So from the Department of Veterans Services perspective, I want to thank everyone for all your service, everyone who is a caregiver, everyone who served in the military, everyone on the front lines who are caring for our veterans and other citizens at this most difficult time. But I do also want to make sure that you are taking advantage of all the benefits that might be available to support you in your work and as you take care of yourselves and taking care of your veterans. So in the Massachusetts, we have wonderful benefits for veterans. We have a veteran service officer in every city and town. And that veteran service officer can assist you with filing claims or applying for other state benefits and services. The department has a special financial assistance program for veterans in need. It's called Chapter 115, but it's really a financial aid program. We also offer an annuity for veterans who are 100% service connected and for those survivors of those veterans who are 100% service connected. We also have some unique outreach programs within the department. We have a suicide prevention program. It's called Statewide Advocacy for Veterans Empowerment. The SAVE team was started to help veterans overcome barriers, whether real or perceived, to accessing benefits and services. They're primarily a suicide prevention program, but they work to try to break down those barriers. There is peer support for veterans to access, whether it's their local VSO or accessing other services that meet their needs. We also have a Women Veterans Network that was started in 1997. The Women Veterans Network helps women access the services that they're entitled to for the over 22,000 women veterans in the Commonwealth of Massachusetts. You know, women veterans are the fastest growing population in Massachusetts and in the nation. They represent almost 8% of women serviced by the VA now, and they're also 20% of the active duty force. So we want to make sure that we're reaching out to help them with their unique needs in accessing healthcare and other supportive services. We also have 2 contact offices to help with VA claims, one in the JFK building in Boston and one in Providence. We have 2 soldiers' homes, one in Chelsea and one in Holyoke, that provide long-term care and supportive services to our veterans. We also have 2 cemeteries, one in Agawam and one in Winchendon. So there are a lot of different benefits and programs through our department, but through many other nonprofit providers that provide housing, outreach, and supportive services, and in some cases, behavioral health and healthcare services as well. So talking about, you know, that you gathered to talk about Parkinson's disease, and as we do know, from veteran services, Parkinson's is a presumptive illness for Agent Orange. So veterans who are exposed to Agent Orange and develop Parkinson's could be filing claims for that connection. And there's also been recent legislation that has added Parkinsonian syndrome to the list of illnesses, along with bladder cancer and hypothyroidism. So I would ask, if you're not aware and you know someone that is looking to file a claim, to please contact your veteran service officer and get that started, or to contact any of your national service officers that can assist with that as well. And then in closing, I would always ask for, any point of service, if you don't already do so when you're working with any clients that come in to access your services in your healthcare systems, ask the question, have you or a member of your family ever served in the military? And from the answer to that question, you will be able to guide them to some other resources that may be available to them. Because if you ask some veterans, if they're veterans, they might answer no, because they may not think of themselves as veterans. But asking about military service or military service within their family will help guide along finding the resources and the programs that are available to your veterans. Once again, I want to thank you. I want to thank all of those of you who have served in the military, and thank you to those who have served so faithfully on the front lines of this pandemic.
Hi everyone, I hope that you're enjoying the program so far. We're about halfway through, and at this point you've been taking in a lot of that good, important, helpful information, and we want to give you this 10-minute break to maybe get up, move a little bit, move your bodies, because you've probably been sitting stagnant for a little bit listening to our speakers so far. So I'm taking off my hostessing hat and I have put on my yoga hat for you. If you do not know, I am a 200-hour registered yoga teacher. I'm also a certified personal instructor. And I am also certified in rock steady boxing, pedaling for Parkinson's. I've been working in the Parkinson's community for about 3 years now, and 2 years prior to that as a volunteer. So I'm excited for these 10 minutes. I'm going to take you through a nice, gentle, easy yoga flow. We're going to do it all seated. That way, if you're someone who has some mobility issues at home, you don't need to get up. You don't need to worry about falling over or anything like that. We're going to do everything seated here. Hopefully, you're in a nice, stable, comfortable chair. And so what we're going to do, it's great for all levels. If you've been practicing yoga for 20 years and you know what you're doing and you want to stand up and do some of these movements, please feel free to do so. But otherwise, we're going to start seated. And what I want you to do is make sure both your feet are planted on the ground. So if you're cross-legged, ground down in both of those feet. Think about grounding down through all four corners of your feet, from your big toes to your pinky toes to your heels. And sit up nice and tall for me. This is really important in your yoga practice. Staying tall from the base of your spine all the way up to the top of your head. Especially Parkinson's, we know that over time, we get that stoop posture. You can get that stoop posture. So we really want to combat that and really stay open through our chest. So we're sitting here nice and tall. And just what I want you to do for me is you can choose to close your eyes if you're comfortable, otherwise leave them open, but maybe try to focus on one focal point. A drishti is what we call it in yoga. And you just want to start to come into your breathing. So you inhale through your nose and exhale through your nose. And what you'll notice is when you exhale, you'll feel that breath in the back of your throat. This is your ujjayi breath. Inhale. And exhale. Good, 2 more times. Inhale. And exhale. Good, 1 more. Inhale. Nice and strong. Exhale. Good. Bring your arms down by your side, palms facing out. Shoulders are down, core is engaged. So we're sitting here, but we're sitting here with intention. We're sitting here very strong. It's like you can feel the energy coming out of your hands, down your legs, through the bottoms of your feet. And if you listen to a lot of the exercise experts in the Parkinson's community or people who work in the speech programs, what they talk about a lot now is moving with intention, because you'll move much more effectively and have better results. So inhale, your arms are going to sweep up nice and big, coming overhead. And then exhale, bring those hands to heart center. Inhale, arms come up overhead. And exhale, palms facing out, make that big circle around you. Good, inhale up. Good, exhale. Remember that breath equals movement in yoga. Inhale up. And exhale, push it away. Good, let's go 1 more time up. Exhale, bring your hands to heart center, and just take a moment here to set an intention for yourself. It's something that's great to do every single day, even if you're not technically practicing yoga, just to create a little goal for yourself. Because it's shown that goal achievement actually increases your dopamine levels. Good, and when you're ready, you can just place your hands on your knees here. And on your next inhale, I'm going to turn to the side so you can see my profile, but you can stay as you are. You're going to arch your back and really open up your chest here. And then on the exhale, you're going to round your spine, bringing that chin to chest. And then inhale, arching the back. You can slightly lift that gaze. And then exhale. This is a modified version of cat-cow pose that you normally might do on your hands and knees during a yoga practice. Good, and do a few more rounds of those with your own breath. Inhale, extension, and exhale. And what a yoga practice really does for you, even if you're someone who might not normally subscribe to yoga, maybe you don't believe in chakras and chi and all that, maybe you think it's a little too out there for you. What it really does is it helps you focus, good, relax, and set your intentions, and you're able to become mindful. And what that helps you do, it helps you navigate your day-to-day life and your day-to-day stressors. In short, it helps you create bigger space between stimulus and response, which is very helpful, especially when you have Parkinson's disease. Good, let's inhale, bring those arms up. Exhale, bring the hands to heart center. Good, now inhale, bring the hands straight up. And now exhale, we're gonna do a side bend over to your left. Good, inhale up to the center. Good, bring it to the right. Good, inhale and exhale. And when you move side to side, think about pulling up out of the rib cage before you do the twist. Good, bring it to the center. Good, to your left. Let's go one more time to the right. Inhale up. Good, to the right. Inhale, bring it back to the center. Exhale, bring those hands to heart center. Good, inhale, hands straight up. And exhale, bring those hands down to your side. With our hands down by our side, this is your modified mountain pose. You can normally do this standing at the top of your mat. Inhale, arms sweep up. Exhale, bring the hands through heart center and come on down to a nice forward fold. Let your head hang heavy here. Maybe move it a little side to side. And just let all that stress just fall right off of your head. Good, and then inhale, start to roll up one vertebrae at a time. Think about stacking one vertebrae on top of the other. And then inhale those arms up high. Good, and let's go one more time. Exhale, forward fold. Good, rolling up one vertebrae at a time. And in yoga, as we get mindful, practicing mindfulness and meditation helps you decrease the stimulation in your amygdala, which is your fear center in your brain, and it increases the activity in your prefrontal cortex, which is where that happiness happens in your brain. And so we want to keep that fear, stress away and activate those prolonged feelings of happiness. Because when you have feelings of prolonged happiness, it actually increases your dopamine levels over time, which of course is what we're all looking for with our Parkinson's disease, right? So inhale, arms sweep up, moving with intention. Exhale, you're gonna open up your arms. One hand goes in front, one hand goes in back as you twist over to your left. And then inhale, center. Good, nice big twist, open to the right. Good, and your gaze can go with your twist. Good, and you can keep moving at your own pace with your breath. Good, side to side. One more time, each side. Inhale up. Good. Bring it back to the center, inhale. And last time, to the right. Good, inhale, center. This time we're gonna come to a forward fold with a swan dive. So pushing the palms away, keep a long spine, chest is leading forward as you come down to this forward fold. Good, rounding up again, one vertebrae at a time. Inhale up. Good, and then push it all the way again, swan dive all the way down. Good, rolling up one vertebrae at a time. Good. On your next inhale, lift that right arm straight up. And then if you can, engage that core and lift this left knee. Real active, my foot's flexed, everything's strong here, stabilizing the muscles, working on that connection between your peripheral nervous system and your central nervous system. Good, inhale, exhale down. Other side, inhale, left hand lifts. Good, right knee lifts, holding here. Core's engaged, you might feel a little shake in your core, and that's okay, it's firing up. Good, inhale, and exhale. One more time each side, inhale, holding here, breathing. So what's happening in a yoga practice that you aren't even aware of normally and you don't need to be aware of, good, exhale. Other side, inhale up, is that not only are you creating new neural pathways in your brain that are helping you to react to stressors in a much more positive way, but you're also working on keeping your body, working on the stability of your muscles and your joints so that you can be more mobile day to day. Inhale, arms sweep up. Good. Exhale, fold. Good. Rolling up. Inhale. Arms sweep up. Let's do that one more time. And fold. Good. Rolling up one last time. Arms sweeping up. Inhale. Exhale, bring your hands to heart center, bowing your heads. And that is our quick 10-minute yoga break during the symposium. Thank you for trying this out with me and for sharing your practice with me. This is something, just this 10-minute practice is something you can do every single day to practice mindfulness, to stabilize your body, to feel more grounded and centered both mentally and physically. Thank you so much. I hope you enjoy the rest of the symposium.
I am pleased to introduce Dr. Okeanis Vaou, who is the Director of Movement Disorders and Deep Brain Stimulation Center at St. Elizabeth's Medical Center. Her expertise is treating Parkinson's disease, atypical Parkinson's disease, essential tremor, and other movement disorders. She is also a board. I am pleased to introduce Dr. Okeanis Vaou, who is the Director of Movement Disorders and Deep Brain Stimulation Center at St. Elizabeth's Medical Center. Her expertise in treating patients with Parkinson's disease, atypical Parkinson's disease, essential tremor, and other movement disorders. She is also a board-certified sleep specialist and treats sleep disorders in patients with movement disorders. Dr. Vaou is skilled in DBS and Botox injections. She received her medical degree from Semmelweis University of Medicine in Budapest, Hungary. Dr. Vaou completed her residency program at New York Medical College, completed 2 fellowships at Boston University of Medicine, one in movement disorders and the other in sleep medicine. Dr. Vaou is actively involved in medical school education. She currently serves as a Tufts Neurology Clerkship Director and oversees the Tufts and BU medical student education, as well as the BU School of Medicine PA student program. Dr. Vaou participates in clinical research, evaluating novel pharmaceutical agents and patient education in Parkinson's disease. She is very involved in raising awareness of early Parkinson's disease and deep brain stimulation. We are delighted to hear from Dr. Vaou.
Hello everyone, nice to see you all. We are going to talk today about updates on cutting-edge research trials and talk about medications that have recently been approved and also some that are in clinical trials. We're going to talk about different levodopa preparations and formulations, new COMT inhibitors, new apomorphine preparations, other dopamine agonists, as well as new mechanism of action such as adenosine A2 agonists. We're going to start off with levodopa formulations other than oral levodopa, which is the inhaled levodopa. Inbrija, I'm sure you have heard about it one way or another. It's been out in the market for a few years now. The indication is for intermittent treatment of off episode in patients with Parkinson's. And it is absorbed within 10 minutes, so it's used as a rescue medication or to bridge the patient from one dose to the other so that the patient does not go into a wearing off state. Another medication that is currently being in clinical trials, it's in phase 3 trial. It's a oral extended-release carbidopa-levodopa formulation that provides rapid initial absorption of levodopa and then sustains the levodopa plasma concentrations for extended period compared with the currently available formulations of levodopa that we have in the market. There are, if you look at the results so far that we have from this study, it shows that the blue line, which is the magnitude of change from baseline, it shows that the response is pretty good, as is with the other medications that they compared to, which is Rytary and immediate release carbidopa levodopa. However, after a few hours, it continues to have a significant benefit on patients' treatment, on patients' symptoms. But Rytary on the gray line, and the red line, which is the immediate release carbidopa-levodopa, have worn off before this new molecule that is being studied. Moving on, we are looking into continuous subcutaneous infusion of levodopa-carbidopa done by AbbVie. This is an investigational drug which contains levodopa-carbidopa and is given under the skin subcutaneously for the treatment of Parkinson's disease and treatment of the on-time, the out without dyskinesia. We are currently recruiting patients for phase 3 trials of this medication and hope that this will provide a long-standing treatment option for patients with Parkinson's disease, and will have significant control of the on-time without troublesome dyskinesias without the presence of motor fluctuations. Moving on, we're going to talk about the COMT inhibitors. This class of medications have been around for many years. We've used Comtan and Stalevo, if you're familiar with this medication, which is a combination of carbidopa, levodopa, and entacapone. Tolcapone, Tarsmar, is an older medication, and also now we have a newer form of this category of medications called opicapone or Ongentys. This medication is very interesting because it's unique. It's once daily oral, and it's a COMT inhibitor, and it's FDA approved as an add-on therapy for levodopa-carbidopa in patients who are experiencing off episodes. What Ongentys does, or opicapone does, it inhibits the COMT enzyme, which breaks down levodopa, and that makes more levodopa available to reach the brain. It's a third-generation COMT inhibitor. Most of the other COMT inhibitors are a 3 times a day dosing regimen. However, Ongentys is once a day and has a very long half-life of over 100 hours. If you look at the graph here, you see the benefit of this medication compared to placebo and levodopa and entacapone and levodopa. The gray line with the white circles is placebo and levodopa, and you see that the change from baseline in off times is not as significant as compared to entacapone and levodopa, which is the gray line with the gray triangles, and then Ongentys at 50 milligrams is even more beneficial for the off times, and a mean of 2-hour reduction in daily off time was seen with Ongentys compared to the other medication. And moving on to an open label extension period, Ongentys continued to provide benefit in the off times. And what was also noticed is that patients did not change their levodopa dosing at all over a whole year while they were on Ongentys. So this sounds very promising for the off episodes of patient symptoms. Moving on to the different and very novel mechanism of action for treatment of patients of symptoms of Parkinson's is adenosine A2A antagonists. Isradefylline has been approved. It's out in the market. The brand name is Neurance. And now there are some other similar molecules that are being looked at. Tozanidant is in clinical trials at the moment. Unfortunately, two of other ones have been discontinued. One of them at phase 3, Prilatinant, and another one, Vipatinant, was also discontinued because they failed to reach the primary outcomes. As for Isradefylline, Neurance, who has been FDA approved for increased to help increase on time without troublesome dyskinesia, the data are promising. It has an indication for adjunctive treatment to levodopa and carbidopa in patients who are experiencing off episodes. It has 2 dosing, 20 and 40 milligrams, and at 20 milligrams there was an increase from baseline of on time that ranged between 0.90 to 0.35 hours. At a higher dosage, the on time was slightly longer, with 0.85 to 0.145 hours compared to baseline. And placebo was much lower on time. And you can see this illustrated very nicely, where you see decreased off time and increased on time without troublesome dyskinesias at week 12. And the pink column shows the improvement in on time compared to placebo and off time compared to placebo again. So there's a significant improvement. And also if you look at study 3, where they're comparing the 20 and 40 milligram strengths to placebo, there is a significant improvement of on time and decreased off time. So in other words, better control of Parkinson's symptoms. We're moving on now to dopamine agonists. As you know, there's a lot of different dopamine agonists already in the market: pramipexole, ropinirole, rotigotine, which is the patch, have been there for quite some time now. Apomorphine has also been available to the market in different formulations, and there's studies that look at different delivery systems of apomorphine as well. And we're going to talk about that in the next few slides. And there's also a new oral dopamine agonist called tavapadone, which is currently being looked at, investigated in clinical trials. Apomorphine. We have apomorphine in different delivery systems. The older one is a subcutaneous injection called Apoquin. Then there's a pretty new sublingual apomorphine formulation that has entered the market this year, this 2020. And there's also studies on subcutaneous infusions and inhaled apomorphine. Apoquin is the injectable apomorphine. It provides very rapid and reliable return to the on state, and it really helps you manage your Parkinson's symptoms by very quickly ending your off periods. You can use it reliably first thing in the morning, and to get you out of that morning off state where it can help you walk, talk, move around, prepare breakfast, and getting dressed. You can use it anytime you want during the day. It's a rescue medication. You can use it up to 5 times a day. This is the pen, the injection pen. If you notice, it has a very, very fine needle that is very similar to the needle that patients with diabetes use for insulin injections. And as you can see here on the table, the solid line is the patients who were taking Apoquin as compared to placebo, and you notice a very fast response to the medication within 10 to 20 minutes, and this benefit lasted for up to 90 minutes, whereas with placebo you don't notice such a big difference from baseline. Moving on to Kenmobi, this is a sublingual apomorphine formulation that recently entered the market, and it provides 3-fold improvement in motor symptoms of Parkinson's disease, and there's a significant clinical improvement shown to occur within 30 minutes. You can take the medication up to 5 times a day. It is used as a rescue medication, and there's no need to time your doses to food. If you look at the graph again here to your right, you will see that this teal green line is patients who took Kenmobi, and you see the response is remarkable within 30 minutes. There's a remarkable improvement from baseline by 15 points compared to placebo. Moving on to a different formulation that is currently undergoing clinical trials is the apomorphine subcutaneous infusion. It bypasses the gastrointestinal tract. It is a very reliable, provides very reliable on time within 4 to 10 minutes and can last up to 90 minutes. It is used as a rescue therapy. It has a very short half-life, works very, is absorbed very quickly, and does not interfere with the medications that the medications that patients take on a regular basis. We do have some data coming out from the preliminary trials about reduction of off time and increase on time without troublesome dyskinesias. If you look on the graph on the top, you will notice that there is a significant improvement for patients who are on the subcutaneous apomorphine. That's the blue line, as compared to the green line, which is placebo. Moving on to a different dopamine agonist, an oral dopamine agonist, which is currently undergoing phase 3 trials. We have some preliminary data. This is a selective partial agonist of the dopamine D1 and D5 receptors. What's different for this is that compared to the ones that we already have, such as rotigotine or pramipexole or ropinirole, is that these have a D2 agonist properties. However, tavapadone does not. And D2 receptor is responsible for side effects such as impulse control disorders, sleepiness, etc. So we are hopeful that this medication, because it doesn't have D2 receptor agonistic properties, then we will have less side effects and better tolerated product. So it is also a once a day medication instead of 3 times a day like the other ones are designed for. So if you look at the table on the right, you again see such an improvement in motor symptoms, in symptoms of Parkinson's disease compared to placebo. Now, switching gears a little bit and moving into deep brain stimulation. The newest development is improved technology in the battery of DBS in the Medtronic system, where BrainSense technology makes Percept the first and only DBS neurostimulation system with the ability to capture and record brain signals while delivering therapy. Physicians can now track the patient's brain signals that correlate to the patient's actions, experiences, symptoms, side effects, or medication intake. This helps us, the movement specialists, to understand the patient's symptoms throughout the day and night and adjust the stimulation accordingly, or even the patient's medications accordingly. So it allows for a really personalized treatment option. Percept is the only DBS system eligible for 3T whole body MRI scans. There is a smart battery that personalizes the prediction of the remaining battery life. It has an improved battery longevity, and it also has the ability the option for a lower pulse width, which allows us to choose to avoid side effects or have less side effects. This is what the battery looks like. It is very new. The first implant was in July 2020 in Mayo Clinic. It was first approved in European Union, an implant in the European Union, and we are now using it at large in our center and in Massachusetts, and nationally it's it's very readily available. We do have some medications and trials that failed. Last few weeks and months have not been particularly good on some of the trials of medications. A gene therapy a medication targeting a certain mutation, the GBA mutation for Parkinson's by Sanofi, called venglustat, did not make it, had to stop because did not meet the primary endpoints. The same happened with Biogen. At the phase 2 SPARK study, did not continue for similar reasons. Something else different than medications, but definitely something to help patients with Parkinson's, we have seen a recent development in wearable technology that helps in diagnosis, helps in rehabilitation assessment, and monitoring patient symptoms. These devices, the wearables, are able to detect motor fluctuations, troublesome fluctuations, dyskinesias, wearing off, sleep, all kinds of information that allow us, the clinicians, to understand what the patient's life is out of the office, in real life, and help with adjustment of medications, DBS stimulation, and optimize their therapy. These wearables are also very helpful in clinical trials, and they can also monitor symptoms if there is intervention with physical therapy or exercise, so we see the improvement. And last but not least, this is something that recently was launched by Nike, the FlyEase shoe, that if you see here, it allows you to slip on the shoe and remove and take off your shoes very quickly, very easy, without having to struggle with Velcros or with shoelaces, and has been designed for people with neurological symptoms and neurological diseases, including Parkinson's disease. So overall, we are remaining very hopeful for the future treatment of Parkinson's. Till this date, we have 24 FDA-approved treatments for Parkinson's, and we have many more coming up. There's a very active pipeline. There's trials in medications, in the type of delivery of medications. There's trials in the how to delay the progression or disease-modifying treatments. There's trials in novel mechanisms of actions. There's innovation in DBS technology and how to optimize therapy. And there's so many wearables that can give us more information as to what these patients' symptoms are and how their life is, so that we get all this, take this information, analyze it, and help treat the patient better. Thank you so much for listening. If you are interested in getting involved in any clinical trials, please do. You are contributing to the next generation of medications and innovation. If you're interested in the subcutaneous levodopa infusion pump, please let us know. We are conducting it in our center at St. Elizabeth's Medical Center. Please contact Caitlin Ramsey on the caitlinramsey@stewart.org, or call us at our center at 617-789-2379. Thank you so much.
Hello, I'm Scott Hunter, Vice President of Sales and Marketing at Amneal Pharmaceuticals. We are very excited to be part of this incredible event, and we are confident it will provide a great spirit of community, education, and inspiration for people living with Parkinson's, their care partners, and families. At Amneal, our team comes to work every day with all of you in our minds and hearts. We are passionate and dedicated to our work in Parkinson's disease. Again, we are so glad to partner with you today in this event and wish you the very best.
Next up, we are excited to introduce Dr. Ornella Dubaz. Dr. Dubaz is the Director of Movement Disorders at the VA Boston Healthcare System and Clinical Director of Neurology at Harvard Medical School, Brigham and Women's Hospital in Boston. She graduated from Temple University School of Medicine in Philadelphia and completed her neurology residency training at Northwestern Memorial Hospital in Chicago. She subsequently completed a movement disorders fellowship at Beth Israel Deaconess Medical Center in Boston. Dr. Dubaz's areas of research and clinical interest include movement disorders, Parkinson's disease, deep brain stimulation, telemedicine, interdisciplinary models of care, and neuropalliative care. Her previous research includes studying medication practices in Parkinson's disease, the benefits of exercise for PD, and clinical trials for disease-modifying treatments for PD. She has received multiple Excellence in Teaching Awards and won the prestigious Susan Perlman Award for Academic Excellence, Special Leadership Skills, and Compassion for Patients in 2019. She is an active member of the International Neuropalliative Care Society, Functional Neurological Disorders Society, American Academy of Neurology, and the International Parkinson and Movement Disorders Society. Thank you for joining us today, Dr. Dubaz.
Good morning, everybody. My name is Ornella Dubaz. I am the Director of Movement Disorders at the VA in Boston, and I'm new to the VA, just started in September, so I've been learning a lot about how to access different resources at the VA for my patients, and so I hope that this talk, which is a product of all of that learning, will be helpful to all of you. So today we're going to talk a little bit about the VA system and how it offers care for vets who have different movement disorders, both on the national level and locally here in Boston. We'll also talk about some exercise opportunities that are available through the VA Boston system, some electronic resources, and then some future goals of the Parkinson's disease and movement disorders care that we have here at the VA in Boston. So if you're not yet a patient at the VA, I encourage you to go to this website to see if you if there are any benefits or anything that you would be eligible for here. And there's a welcome kit that you can download and phone numbers for you to reach individuals to ask about what you might be eligible for. So there are two kind of groups of facilities at the VA in the US that help to care for vets with Parkinson's disease and other movement disorders. There are the Parkinson's Disease Research, Education, and Clinical Centers, also known as the PADRECs, as well as sites that are part of the VA PD Consortium. And the PADRECs, there are 6 in the country. The closest to Boston is actually in Philadelphia. And these are designated VA centers of excellence that really specialize in Parkinson's disease research, but also clinical care, of course. The consortium sites are separate. There are about 50 of these in the US, and Boston is one of those sites. And these are VA sites that have movement disorders or Parkinson's disease specialists available. And here is a graphic from the website, actually, parkinsons.va.gov, that shows the different PADREC centers and how to potentially reach individuals there, as well as the consortium centers. And you can see, I just highlighted a few of them here, Boston, of course, but also Central Mass and Connecticut, which are the closest sites that have subspecialty care available. And the contact numbers are there. You can see that Dr. Durso is the director listed for Boston, and he was the director who I took over for in September. The phone number's correct, though. So within VA Boston's healthcare system, we have Parkinson's disease expertise, as we are a consortium center. So we have subspecialty clinics for movement disorders in Jamaica Plain and in Brockton. And we have Parkinson's disease specific clinics, as well as deep brain stimulation clinic and a botulinum toxin clinic. We collaborate with multiple departments and specialists elsewhere within the VA system as well. There are many exercise opportunities that are available through the VA Boston, and so I'll talk a little bit about that. The first is a VA PM&R annual assessment for chronic progressive neurologic diseases. This is a really amazing program that's done with our physical therapists here at the VA. They will evaluate a patient with any type of chronic neurodegenerative disease and basically come up with a treatment plan and then follow that patient every year annually and do different assessments and come up with changes and adaptations to that plan in order to help the veteran basically maintain optimal physical fitness and health. There's also the LSVT BIG program, which I think is very well known in the Parkinson's world as an excellent program for physical therapy in Parkinson's disease. We do have this available at the VA. We have physical therapists who are trained in this program, and if you're referred to see them, they'll evaluate and see if this would be the right program for you. There's also a VA VVC PD exercise group, so this is all done virtually right now, and it meets twice a week. It's all done by telehealth, and you have to have been evaluated by the Parkinson's disease physical therapist in order to then enroll in this exercise group, but I hear that people really enjoy it. And finally, there's the VA GeroFit program. This is available not just to veterans with Parkinson's disease, but really to any veteran who's over 60 years old, and it's a free program. It focuses on aerobic, strength, balance, and flexibility training, and there's a phone number listed here that you can call for more information. So there are two other programs at the VA that I want to highlight today that I think patients might really enjoy. They both require consults, and so patients can be referred to them through primary care or through neurology or whoever they're seeing. It's generally done through primary care though. The first of those is the VA Boston Adaptive Sports Program. This is a program to allow veterans to participate in a number of different sports and activities that they may have enjoyed previously or just want to really learn about now that they may not have tried previously but are interested in. And of course, a lot of this is on hold in the setting of COVID, but I know that this program will continue to run afterwards. They are adapting a bit now and doing some things virtually, so it is still running, but there aren't quite as many activities as there had been previously. And here I have a list of all the different organizations that they work with locally in order to allow veterans to participate in all of these different sports. So curling, sailing, hockey, skiing, horseback riding. There are just so many different opportunities, and they will adapt those different programs for whatever your physical fitness or ability level is. The second program that I mention, that I'd like to mention, is called the Whole Health Program here at the VA. This is really an approach to healthcare more than just one program. So in this program, there's a coach that's assigned to you, and that really allows you as a veteran to share with those who are taking care of you what matters most and try to participate in a number of different opportunities that can help improve physical health, mental, emotional health, and wellness just in general. Again, this is a program that you can be referred to through your primary care physician. And on this next slide here, I just show some of the different opportunities that they have. So there are wellness classes that are available. Right now they're doing VVC classes. They have adaptive yoga, Tai Chi, guided imagery, but there are also classes by phone, and there are a number of videos online that even if you're not officially part of the program, you can watch and use, and I just highlight some of those here on the right side of the screen. Meditation, joint mobility exercises, posture exercises. There really are quite a few that you can look through. And the phone number is listed to make or schedule an appointment if this is something that you're interested in, want to learn more about before you even talk to your primary care doctor about it. Moving on to electronic resources. So the first slide I have here is about the Parkinson's Foundation. I think you're going to hear a lot more about them in the talk that follows me, but I would like to just highlight here that it's an excellent organization that I encourage any veteran with Parkinson's disease to go to the website and sign up for their newsletter. And I just show here, this is a screenshot of the bottom of their website where there's this little gray area within that says be the first to know, and you can put your email address in there and they'll email you a newsletter that has updates about upcoming programs, research, other things that you might find helpful. And so I'll focus a little bit more time on our website, which is parkinsons.va.gov. This is actually designed by the Parkinson's Disease Research Education and Clinical Center program, the PADREX, with input from the VA PD consortium sites as well. And there's a lot of information in there that I think is really helpful and that a lot of veterans don't know about. And so if you look at the web page, over on the upper left-hand side here, you can see the different tabs that you can click under. And there's one that says for veterans and families that has a lot of information. And I'll show a few different resources from that section that may be beneficial. The first is the PD at Home Free Parkinson's Telephone Education and Support Conference. This is for veterans and caregivers of veterans, and it's on the second Tuesday of every month by telephone. My understanding is that they have some sessions that are more kind of support group oriented, but recently a lot of the sessions have actually been talks by experts from around the country. So just a few weeks ago there was a talk about orthostatic hypotension, for instance, which is when patients feel lightheaded when they stand up too quickly. And there was also a talk about how to manage constipation. And these experts will give some tips and tricks on how to manage those things at home, which I think a lot of people find helpful. I just have a couple slides here because I'm hoping that you'll get a copy of my slides at some point. They are really pasted from the website, so you can always access this information on the website. But they highlight a few of the other support groups that are run by the different programs that care for Parkinson's patients around the country. And right now, these are all virtual. And so really, I think any individual is welcome to attend virtually. There's also a section on the website called My Parkinson's Story. This will actually link out to YouTube, where there are a number of different videos that talk about different aspects of Parkinson's disease, all told by veterans. And so if this is something you're interested in, you can go to that YouTube site and listen in just on the topics that you might potentially be interested in. Here there's a little sampling: deep brain stimulation in Parkinson's disease, thinking and memory problems with Parkinson's disease. There are multiple topics, and you could choose the ones that you're most interested in. There are many other resources on the website, so I won't go through all of them, but lots of patient education brochures, resources about different exercises you can do at home, hospitalization kits. There's this nice reminder card that you can download that you can bring with you to the hospital if you ever need elective surgery, like a knee replacement or something else, just to remind the nurses and other staff in the hospital about Parkinson's and some of the things that they should be aware of, medication interactions, that kind of thing. There's also information for care partners on the website. And here I just copied the suggested education essentials document from the website that I encourage you all to download, because this is really a nice 2-page sheet that has lots of information on it about different resources that you might find helpful. Overviews about Parkinson's disease, exercise, medications, nutrition, organizations you can reach out to. And so I think that that's really helpful. And then in terms of care partner resources, I put here the information for the VA caregiver support line, which is a toll-free line that's 6 days a week. They're operational, and so if you want to call and find out if you are eligible for any benefits or other assistance through the VA, this is a good place to start, and they can try to help you find somebody at your local VA who can potentially help. And lastly, from the website, there's information about Parkinson's disease and various military exposures. For instance, Agent Orange exposure has been linked to Parkinson's disease, and so you can be service connected for having had that exposure and subsequently being diagnosed with Parkinson's. And there's information on the website for these exposures and how to kind of talk to people in the VA system about what benefits you might be eligible for. And then I'll just leave you at the end here with some information about things that are coming here to the VA. So we're trying to really build out a larger movement disorder center here at the VA in Boston. Part of that is bringing DBS to the VA, as well as a focused botulinum toxin clinic, which I mentioned at the beginning. But we're also trying to start an interdisciplinary clinic specific for Parkinson's disease, where individuals will meet with multiple team members that are trained in Parkinson's and get kind of get to know you session where you get to know these different providers and what different support you could have here. And with that, I thank you for your attention, and I have my name spelled out here at the bottom, as well as the phone numbers for the neurology clinic here at the VA in Boston, and I hope to see you all in real life someday soon. Thank you.
Hello, my name is Ann Muskoff, and I'm the director of the Charlotte and Richard O'Connell Parkinson's Family Support Program at Jewish Family and Children's Service in Waltham. We serve families of all backgrounds who are affected by Parkinson's disease by offering programs that foster resilience and connection. During these times of social distancing, we continue to offer all of our programs in a live virtual format, which include Parkinson's dance, chorus, support groups, and information and resources to help navigate PD. So join us. For more information, please call or email me at 781-693-5069 or parkinsons@jfcsboston.org. Thank you, and I look forward to hearing from you.
Next, we will be hearing from Melody McLaughlin and Samantha Chung from the Parkinson's Foundation to discuss the Foundation's new partnership with the VA to help veterans living with Parkinson's disease. Melody McLaughlin is the Senior Community Program Manager for the New England chapter of the Parkinson's Foundation. Melody came to the Parkinson's Foundation in April of last year, having spent much of her career working with the older adult population and individuals with Alzheimer's and other dementia. Melody's primary role is coordinating the New England and Mid-Atlantic chapter's community-based education programs that engage local experts to discuss topics relevant and important to the PD community. Samantha Chung is the development manager for the New England chapter of the Parkinson's Foundation. She has been with the Parkinson's Foundation for 2.5 years and coordinates all the New England chapter's community fundraising events, including Moving Day and Parkinson's Revolution. With great focus on the community, you may have seen or met Sam tabling at a local Parkinson's symposium or while sharing resources at your support group. Welcome, Sam and Melody.
Hello, everyone. Huge thank you to 110 Fitness and St. Elizabeth Medical Center for allowing us some time to share an update about Parkinson's Foundation and our new Veterans Administration partnership. I am Sam Chung, Development Manager of Parkinson's Foundation New England chapter. My colleague, Melody, and I are both very excited to share an overview of what we do as the Parkinson's Foundation. Let's get right into it. The Parkinson's Foundation is the nation's leading community for people with Parkinson's disease, the people who love them, and all those who are working to end the disease. With our presence in the communities across the country and the globe, we believe in the promise of a cure and a better life today for those impacted by PD. The urgency of our mission really translates into what we do. To achieve our mission, we pursue 3 goals: ensuring better care for everyone for today, understanding Parkinson's through research for tomorrow, and educating and empowering the community for us all. We provide free resources, including our website, parkinson.org, educational book series, webinars, podcasts, our hospital safety kit called Aware and Care, our newly diagnosed kit, and of course, our toll-free helpline, 1-800-4PD-INFO, which is staffed by Parkinson's specialists. On the research front, we invest more than $10 million annually to study Parkinson's, what causes it, how to treat it, and ultimately how to cure it. I like to highlight PD Generation, which is an initiative that offers genetic testing and genetic counseling at no cost for people with Parkinson's disease. We are thrilled to announce that PD Generation has launched its next step, a genetic test that can be completed at home. To learn more, visit parkinson.org, PD Generation. So how do we connect with our communities? Hopefully being here with you today is an example of that. And Melody will share how we specifically connect with our veterans community in just a bit. But it's also through our centers of excellence, local PD experts and supporters, including St. Elizabeth's and 110 Fitness, volunteers, advocates, and staff across the country that we bring together to educate and empower those impacted by PD. Because we rely on energy, skill, passion of people like you to make life better for people with Parkinson's, there are many ways you can get involved. Many of you may recognize me from Moving Day Boston. This year is our 10th anniversary since our first Moving Day in 2011. Together, our Moving Day walks have raised over $30 million to support the Parkinson's Foundation mission. We hope we can reunite again in the fall for Moving Day Boston. In the meantime, we are very excited to share we are bringing Moving Day New Hampshire in May. To learn more, please visit movingdaynewhampshire.org. And to find a Moving Day near you, visit movingdaywalk.org. Whether you're interested in sharing your story, learning more about Parkinson's at an education program, or getting involved with research, there is something for everyone at the Parkinson's Foundation. We look forward to connecting with you. And with that, I will hand it over to Melody to discuss the Parkinson's Foundation's partnership with Veterans Administration.
Great, thank you, Sam, and hi, everyone. I appreciate Sam providing that great overview of the Parkinson's Foundation mission. I'm Melody McLaughlin. I'm the Senior Community Program Manager for the New England chapter of the Parkinson's Foundation. As Sam had shared, the mission of the Parkinson's Foundation is to reach every person living with PD. A key way we do that is through developing partnerships with other organizations that really enable us to go deeper, have a greater impact, and expand our reach to people with Parkinson's, their care partners, the clinical community, and of course, the research community. In April of last year, the Foundation launched an exciting new partnership with the Veterans Administration. This partnership is particularly important as we know there are more than 110,000 veterans living with Parkinson's today. The goal of this partnership is to, 1, increase access to PD information and resources for veterans and health professionals treating veterans, 2, educate VA staff on PD disease management and modifying therapies, 3, helping to improve coordination of care, and 4, of course, the ultimate goal being to improve quality of life for veterans living with Parkinson's. The Parkinson's Foundation is working with the VA on both a national and community level by developing and building on relationships across the country. For example, there are 6 VA Parkinson's disease research, education, and clinical centers across the country, 51 VA consortium centers, as well as VA telehealth PD services, all working to provide the best possible care for veterans with Parkinson's. Combined with clinical collaboration, training, and resources through our Parkinson's Foundation Centers of Excellence, this partnership supports both a top-down and bottom-up approach to push out education, resources, and information. And not only is the Parkinson's Foundation working in collaboration with our VA colleagues in the PADRECs, consortium centers, and COEs, but also within support groups, events, and more to create greater awareness of all that the Parkinson's Foundation can offer to veterans and their care partners, and really help to ensure those resources are getting into the right hands of the people who need them most. Whether you want to learn about non-motor symptoms, motor symptoms, the importance of exercise, this information is all available to you however you may want to access it, whether reading it, listening to it, or watching it. Also, there are many ways to connect with us and your PD community. You can contact our helpline and talk to an information specialist. You can connect through our online community, PD Conversations, to connect with others living with Parkinson's or care partners, or join our weekly health and wellness programs, including PD Health at Home, which are all virtual and at no cost to you. Through this partnership, we are also increasing access to and awareness of the Foundation's resources for VA health professionals who care for veterans with Parkinson's, and really enabling them to share resources with their patients readily. This includes providing information and training for the whole PD care team. This includes nurses, occupational therapists, physical therapists, speech therapists, social workers, you name it, with access to online courses, podcasts, expert webinars, and of course, our helpline information specialists. Meaningful training around these clinical issues specific to veterans with Parkinson's will raise the quality of care for all people with Parkinson's and is a vital piece to this puzzle. And well, what about research? Through this partnership, we are also able to create more awareness and across the important aspects of research in veterans with Parkinson's. This partnership will also strengthen opportunities to engage VA medical centers in research and promote awareness of active studies going on, including PD generation. So where to start? We acknowledge that sometimes knowing where to start can be the trickiest part of all. Here are some ideas. You can call the helpline, again, staffed by Parkinson's specialists, including social workers and nurses, who can pinpoint you in any which direction you are looking to go first. You can visit parkinson.org/veterans for all resources and materials that are specifically tailored towards veterans. You can join PD Conversations, the Parkinson's Foundation online community where you can ask experts your Parkinson's questions and be part of a network of support. And last but not least, you can attend an education program, Knowledge is Power. And as I mentioned earlier, such an important element of the Parkinson's Foundation partnership with the VA is the top-down and bottom-up connections that we are excited by the momentum that is already taking place in certain regions. We hope that this incredible information and resources you obtain today will inspire you to continue learning and join us later this month for our program for veterans on March 20th. And with that all said, it's important to keep in mind that this partnership is less than a year old. We are very excited to see the growing interest and engagement to help support all veterans living with Parkinson's and allowing them the resources they need to live their best life. We are here for you, and we hope you'll connect with either myself or Sam, or feel empowered to visit parkinson.org or call our helpline for more information, resources, and upcoming events. We still look forward to learning with you today and sharing this time together. Many, many thanks to our dear friends at St. Elizabeth's and 110 Fitness for the invitation to join you and for their leadership in supporting the Parkinson's community. Thank you.
Hi, my name is Melanie Dizon, and I'm the Director of Education at the Phinney Foundation. Our mission is to help people with Parkinson's live well today. We do this through our blog posts, podcasts, webinars, virtual and live events, our ambassador program, Team DPF, which is our grassroots fundraising program, and our very popular Every Victory Counts manual that we are able to give to everybody thanks to our sponsors. If you'd like to learn more about how to live well with Parkinson's today, please visit us at dpf.org. Thank you.
Greg Brasso has spent the last 8 years helping veterans identify and apply for local, state, and federal programs and benefits they have earned. While working as an outreach specialist with the Veterans Upward Bound program at UMass Boston, he has helped other veterans identify military transfer credits, GI Bill, and Yellow Ribbon benefits. And he has planned an educational path that will lead to post-secondary education and onto meaningful full-time careers. His voice on the Veterans Voice radio show addresses these and other veterans issues and to provide directions to benefit applications. Please welcome Greg Brasso, host of Veterans Voice, as he gives us an overview of the great services he provides for our veterans. Mr. Brasso.
Hello everybody, Greg Brasso, your host, creator, and producer of Veterans Voice Radio, here on WATD, WMEX, WBMS, and the TIC network. The show was formed 7 years ago to bring light to the veterans benefits and programs and providers that are out there for the veterans community to gather the information. And one of the large problems within the veterans community has been the dissemination of programs and how to apply for them. Well, we team up with the Boston VA healthcare system, and through our efforts, we have introduced hundreds of veterans to the ease of entry into the VA healthcare system. Each town has local representation so that these benefits are easily within the grasp of the veterans to enjoy. as a supporter of the Mass Coalition for Suicide Prevention, we've had several award-winning shows that are trying to come to the bottom of the list as to why veterans are taking their lives by suicide at such an alarming rate. Maybe you have a disease that has been directly tied to Agent Orange. There's diseases such as diabetes, cancer, and a very large one close to our heart is unfortunately Parkinson's disease. We've enjoyed success over the past years by organizing events. Our events include renting the Battleship, Massachusetts for a 6-hour music festival and attracting 1,500 veterans and their family to a giant music fun-filled day with about 50 veterans benefit providers also in attendance to give the veterans not only a great day out, but exposure to veterans benefit providers they thought were mysterious, the VA. Not an alphabet soup kind of group. They're our friends. They treat our veterans very, very kindly and very warmly, and we rely quite a bit on events like Battleship Cove to bring awareness to our cause. In addition, each year we have a veterans train ride that we provide train rides for 600 veterans from Boston to Hyannis to participate in the largest veteran celebration of the year, Cape Cod Cares for the Troops, held every year in Hyannis. Men and gentlemen, my best friend, we'll call him Chicago Mike. Chicago Mike was a champion golfer. Wow, he just played. It was so easy to him. His parents had a house on the Skokie Country Club in Chicago. What a kid. Hit the golf ball a mile. Unfortunately, 5 years ago, he contracted Parkinson's disease. And unfortunately, Mikey lost the ability to play golf right-handed. But being a marathoner, being a champion tennis player and a champion golfer, although he lost the ability to play right-handed, he taught himself to play left-handed. And last year he created a 100-hole golf marathon to bring awareness to the Parkinson's disease and the foundation and what it meant. Sideways to this, I get a phone call from our friends at TISN Network, Anna Dunbar, about this group at St. Elizabeth's Hospital. They were sponsoring a Veterans with Parkinson's Symposium. Wow. What a partnership we have created. Because come to find out that 10% of the Parkinson's sufferers are veterans. Folks, that number is outstanding because 1% of the country's population have served. So that number is 1% out of 1 million sufferers. It should be 10,000 veterans that are suffering. Instead, there is somewhere over 110,000. So to that end, we've created our own version of a 100-hole golf marathon. This is going to be held August 21st and 22nd at the Twin Brooks Golf Course in Hyannis, Mass. Our good friend Fred LaSalva has offered us the use of his beautiful par 3 golf course, have at our disposal for a 2-day golf marathon. The event will feature all sorts of special activities. It's not going to be like hush and quiet. The 5 hours worth of music will be headed up by WMEX, our music partners and co-promoters of the event. Our producer, Benny Rabbi, will be there and will be providing background music as well as helping us to line up the correct musicians for the 5-hour music festival, which is always a tremendous success. But throw in free food for everybody starting at 11:30 lunch, and we have a full day planned. Some benefits are being provided to veterans that might not have been aware or certainly were not taking advantage of them.
Hi everyone, I'm Melanie Demakis with the Michael J. Fox Foundation, where we fund Parkinson's research at its most crucial stages to help speed better treatments and a cure as quickly as possible. I encourage all of you to check out our website where you will find webinars, podcasts, and articles on a host of PD topics. And also later this year, you'll be able to access the Parkinson's Buddy Network, which is an online platform designed to help members of the Parkinson's community connect with one another. We really encourage everyone to get involved, whether it's in research, Team Fox fundraising events, or even better educating yourself about Parkinson's. So please feel free to connect with the Michael J. Fox Foundation anytime. I hope you all enjoy the event today and hopefully get to see you in person next year.
Next up, we'll be hearing from Boyd the Rainmaker Melson. Boyd is a retired professional boxer with a record of 15 wins, 1 tie, and 1 loss, with 4 of those wins coming by knockout. A true philanthropist, Boyd donated all of the money that he earned in his boxing career to spinal cord injury research, and his efforts have been profiled on Real Sports with Brian Gumbel, ESPN.com, Sports Illustrated, and Yahoo, the Huffington Post, and the Wall Street Journal. As an amateur, Melson won the 48th World Military Boxing Championship gold medal in his weight class. He was a 4-time United States Army champion, a 3-time NCBA All-American boxer, a 4-time West Point Brigade Open Boxing champion, and received the Colonel Marcus Award. He also won gold medals at the All-Army Boxing Championships twice and at the Armed Forces Boxing Championships twice. He made it to the quarterfinals in the welterweight 2005 World Amateur Boxing Championships and won a bronze medal at the 2005 U.S. Amateur Boxing Championships. Boyd is a West Point graduate and currently serves as a major in the U.S. Army Reserve. Fighting back against Parkinson's disease is a familiar battle for Boyd, as he is a caregiver for his father who is living with Parkinson's. Welcome, Boyd.
Hello, my name is Boyd Melson. I am a major in the Army Reserve. I'm proud to say I'm a West Point graduate. I am an Iraqi combat vet as well. Throughout the last 10 years now, I've devoted my life to various causes. I've tried to help champion finding a cure for spinal cord injuries. I've spent time working with minority youth. I'm on the board of Boxer Inc., where we use boxing as a mentorship program to help inner city youth here in New York. I'm on the advisory board of Stop Soldier Suicide. Speaking of veterans, so we know what that challenge is. I've worked as a mentor. I served as a mentor at the Steve Harvey Youth Mentorship Camp. Those 200 boys, 11 through 18, without daddies active in their lives. For about 1.5 years, I used to run free boxing clinics for people trying to live a sober lifestyle. And I try to serve as a champion the best I can, especially just to youth overall. I spend a lot of time traveling to schools. I have over the last 10 years speaking, trying to help inspire their curiosity, their own lights. And when I was an amateur boxing for the Army, I was a 4-time Army boxing champion. I was the 3-time Armed Forces champion. 1 time I was the world champion of all the militaries in the world. I placed as high as 2nd in the US, placed as high as 5th in the world at the World Championships, and I was an alternate for the Olympics in 2008. As a professional, I'm proud to have earned the WBC, that's the World Boxing Council, United States Junior Middleweight title. I'm also an ambassador. I'm an ambassador of peace for the World Boxing Council, that's the WBC. As well, I'm the WBC Ambassador of Peace. I traveled to Israel last year with Gloves and Doves as the WBC Ambassador of Peace, where we used boxing to try to bring Jews and Arabs together. It was a really neat experience. And what else? Is there anything I'm missing? When I was a professional boxer, I donated everything I earned my whole career, 100% of my purse, to spinal cord research, and that was because I once fell in love with a young lady who was paralyzed due to a spinal cord injury. And while we were together, I promised her I'd never give up on helping her walk again for the rest of her life. We are not together any longer, but I made a promise, so that was not dependent upon us being together. So, the reason I'm speaking here right now, my daddy, my father, has Parkinson's. My father served 35 years in the military, 6 of those years in the Navy, 20 active duty. And then what I came to learn later, that when he was a JROTC first sergeant, that was considered active duty time as well. My mother served 3 years. She met my father when they were both stationed in Germany. My father was teaching a race relations course, and she was an enlisted in his NCO taught course, so some frat went on. That's what I'm a result of. And my sister was a JAG officer. She was deployed twice, once to Saudi and once to Iraq. And my brother was a medic in the Army Reserve while he was in JROTC at University of Southern California, and then he was commissioned as a public health service officer, which I believe he served in for 4 years. And my father, like I said, has Parkinson's. And I found this out while I was deployed in 2018 as part of Operation Inherent Resolve. And I found that out during that summer. And fortunately, he moved back from California to New York that summer. So my parents are not together. My mother lives a few miles away from him, and she's over here all the time. They have a unique relationship, but the component is love and having shared children. And I'd say last year was around April, right at the time when both my parents and myself came down with COVID. My mother asked me if I would be interested in moving on in and to help take care of my daddy. And immediately I said, no way, I'm an independent sucker. I've been out of the house since West Point. And that was in '99 I left for West Point. But I thought about it some. And I came to the understanding that, I'm 39 going on 40. So at the time I was 38. And I'm not married and I don't have children. And I thought to myself, when will I ever have an opportunity at this stage in life to just be a daddy to my son without any distractions? To be a son to my daddy without any distractions. Boxing's a hell of a drug. I hope you enjoy that one, Brett. So, I called my mother back and I said, I'm going to move in with Pop. I'm going to give him 1 year. It's a 1-year deployment. And it's felt like a deployment during COVID because the world has kind of stopped outside. So it's only helped me and allowed me to focus my energies and intentions on my daddy. I've had no experience with Parkinson's throughout my life. Intimate experience, outside of knowing the celebrities like Freddie Roach, Michael J. Fox, and Muhammad Ali. My grandmother had Parkinson's, but the only symptom I would ever see, because there was space between us, I wasn't living with her, was her shaking, and the same with my mother's brother, the shaking. So, has that ever changed? So the daily regimen with my father for his carbidopa, levodopa he has to take is he takes it at 8 a.m., 12 p.m., 5 p.m., and 10 p.m. And it was a pattern here for me to learn the responsibilities. And when I kept seeing him forget to take his medication, and I would see it not by him admitting it, but by his symptoms flaring up, I started to realize, step one over here, I need to help manage his time. His time in terms of being aware when it's time to take his medicine. So every day I have in my phone my alarms set for 8, for 12, for 5, and for 1700 and for 2000. And I keep it at military times on my phone. And no matter where I am or what I'm doing, no matter what time I go to bed, if I'm home, I wake up, I leave my room, and I go in the back to see he's up. Usually he is, but sometimes he's not. And at those times, I feel frustration that he didn't wake up, and I've got on him to set his alarms too. But most of the time, I just feel like I'm doing my job, and that's why I'm here. So he takes his medicine when he's asleep or he forgets. His blood pressure is something. His blood pressure, because my father also has congestive heart failure along with being 100% service connected from his time in, and he has Meniere's disease. That's an equilibrium challenge he has. Stems from the inner ear, if I remember correctly. So his blood pressure, it varies and ranges, and it slows him down, and it happens a few times a day. One of the times when it does go is when he hasn't taken his medication, and I can't, there's times I'm just not there, or I'll tell him and he says okay, and he just forgets somehow still. And after a certain period of time, I started to decide to ask him, did you take your medicine? And he would say no. And then I would get frustrated because his symptoms presenting themselves because he didn't take his medication are night and day as far as what scenario we're in that moment when he does take his medication. And then I get frustrated to say, why didn't you tell me you didn't take it? Because all you have to do is take it, and in 20 minutes they will reside. But you're going through all these emotions now every time as if you may not be here any longer, and you're concerned about that, as he would be or should be. My father, one of the most crippling so far symptoms is the constant phlegm he produces. He produces phlegm all day long, and all day I hear him coughing like you're breathing into, sucking in deep, and one of those real loud. And his stomach becomes distended after any single thing he eats or drinks. And he's nauseous all the time. And what happens with that phlegm is they occlude, which means plug, create a hole, they block his nasal passages. And it makes it very hard for him to breathe, and his saturation level for his oxygen, blood saturation, yo-yos throughout the day. And he has to spend every day taking a bottle of saline and shooting it up this nostril and blowing out as hard as he can from that one to try to clear the plugs out. And sometimes it's an hour to 2 hours, and sometimes I'm back there because I have to pour the packets, and he fills the water up in the little thing. I pour the packets like a line assembly to give it to him, and I'm just staying with him while it's happening. His memory is going. What I have learned, if I create an event where I give him a stern talk about something that he keeps forgetting to do, so he really sees how it affects me, and maybe sometimes it takes 2 times of that, he kind of gets it, and I think it's because he attaches the emotion of me to what he's supposed to be remembering. It's hard, though. It's hard seeing your father's body atrophy when he was built like me. When he was around my age, I'll be 40 this year. He was Superman, the strongest, the toughest. And I see a body that is my build. I took his exact build. I see it, and I just think what this could be my body one day, because I am him when he was my age. And now look at him. He doesn't complain, but he does want attention when he's not well. There's something about him feeling that someone has their eyes on him that gives him that peace. Even though I may be down the hallway, he'll make a point to come and knock on the door and say, please just come check on me sometime during the night, even though I check on him multiple times during the night and day. He just likes to know. I come home every day, and every time I walk by his room and he's asleep, I stop to make sure his chest is breathing, is moving, every time. Every time I I come in the house and there are no lights, and he has a walk-in closet, and his room leads to the bathroom. We live on Fort Hamilton Army Base, which leads to a walk-in closet. And the TV's not on, and I don't immediately see him. I prepare myself to find him laying on the floor unconscious every day. Talk about PTSD. I remember one day I came home from reserve duty and I was in uniform, and he came and walked down the hallway looking like death and just said, "Son, I need you back there with me." I was on my 14th of 14 days of straight consecutive reserve duty and tired, and none of that mattered. And I went in the back room with him. I took my military blouse off. I went in the back room and I started helping him with filling up the saline solutions. His blood pressure was 150 something over 1 something in the teens, and his heart rate was high 90s. And while I'm back there with him and I'm helping him, I look in the mirror, and it was the most surreal experience. I'm in my fatigues with my shirt, the t-shirt tucked in, and I'm in good shape. And he's the one sick. And he's become so much smaller than I am, so much smaller than he was. And I looked in the mirror and I thought, oh my God, the roles have reversed. I'm wearing the uniform my daddy used to wear when he used to come home and take care of me when I was sick. And he had muscles like I do. And he was so strong and comforting. And now it's my turn. I take such pride in taking care of him. And he's so difficult at times. And the hardest part for me, it wasn't him, it was me. I refused for so long to accept what this disease was doing to him. I didn't want to give up who he was. And I gave him a hard time for many months when I moved here, because I just believed he had a choice. And that was on me. And I was hurtful at times I shouldn't have been. And I was mean at times I shouldn't have been. And most important, I wasn't patient with a human being suffering from Parkinson's like I should have been. I wouldn't have been that way with someone who wasn't my father. My patience would have been inspired. But I didn't want to accept that this is happening to him. I hate it. I watch him suffering every day. But he still finds ways to remind me he's my daddy. Still brings home food. When he has some, he brings extra for me. I just started a master's program, taking intermediate stats, and he went and bought a help book for me that's made it so much easier. One of the gifts I was given was from a man who for the last 12 years has been using music to help people with Parkinson's. And I got to join one of his Zoom classes. And it was so cool. He had everybody on, and he had his piano, and he would play the beginning chords of the melody of a song from the 50s or 60s for that audience. And everyone listening had to try to guess the song. And then he would play a little bit more if they didn't. And then he would start singing with it until they caught on. Then he would ask anyone in the audience to name a fun fact about the performer, the artist, or the song. And he would put the lyrics up for everyone to sing along and tap to the beat. And one time with my daddy, my mother let me know that he finally admitted that this is not a way to live. And I walked right into my room and I grabbed my iPhone and I went in, and my daddy's Louisiana Creole, and jazz is all he listens to. So instead of being a victim with that mentality, I thought, hey, I just learned about this. Let me give it a try. And I walked right in. I put on a playlist on Spotify, and I just put the music on. And I said, Daddy, who sings this? And he was speaking in a really weak voice and tired. And by about the fourth song, he was leaning up, squinching his ears, really trying to listen, was speaking in full volume, trying to get the song, getting the song, and then on his own, telling me different things about the singer and then their past and who they were inspired by. And then he started scatting the beat, but he got one of those going with the saxophone. And he didn't clear his throat one time. He didn't move like he was sick. And if I got him to forget for that moment, that was a moment. And now I've been doing that with him. And he looks forward to it. And I start dancing to the music and rocking out and getting the beat and snapping and jamming with my daddy to jazz. And now I play jazz on my Spotify when I go to sleep every night, and I sleep through it because something about now has made me feel closer to my daddy when I listen to that music. On a bright note, we just found out that his stomach distending and his constant phlegm absolutely is Parkinson's related, and there is a medication for it. It's a rare medication. It's 1 pill a day he has to take for the rest of his life. That hasn't arrived yet at the pharmacy, but it will soon. And he let me know that this pill cost $500 per pill. Thank God he has his medical insurance from his retirement from service and then from the Board of Ed doing JROTC, and he has a private one. $500 every day for the rest of his life, a pill so he doesn't have to suffer in a way that I've even told my mother I wouldn't mind if he said he's throwing the towel in, because that's how bad I watch it with him. But he doesn't complain. And I can't wait for that medication to come in. I can't wait. He tells me, I'm not going to check out, son, until you give me a grandchild. A grandson specific. Well, I can't make that go any faster because I have to meet somebody. But I told him I have a short-term goal for you. I need you to stick around for Sergeant 4. I should be getting promoted to Lieutenant Colonel around August of 2023, and I sure would love for you to put my silver oak leaf on. It's the bright moments we gotta find. Because this sickness doesn't discriminate. So we gotta find them and hold on to them and enjoy them and be patient. God bless all of you. Thank you for your time.
We want to thank you for joining us this morning for our 3rd annual Parkinson's Disease Symposium. On the behalf of St. Elizabeth's Medical Center, Department of Neurology, and 110 Fitness, we thank you for joining us. We hope this information has been of benefit. If we can be of further information, please do not hesitate in contacting us. We are grateful of all of our presenters and for the Veterans Administration in joining us today. Thank you and have a great day.